So here is how to make a morning reprogrammer. And a lot of us are teaching this kind of same model now. And that should tell you something. When a lot of us that have dozens of years of experience and combined hundreds of years of experience, we all get together and we say, you know what? We think this works the best. And me and a bunch of my friends are teaching this model right here that we've all put a little bit into to help each other, and we think this is the best way to avoid bite changes. So here's the armamentarium. I use Thermacryl Plus from Airway Management, from the TAP folks there. So you got a little bit of this Thermacryl Plus, you have a tongue depressor, and you have some shim stock. And I'll show you why the shim stock here in just a second. So the material is a thermoplastic, so you just pour some hot water in there, and then you can get that thermoplastic, and you want it nice and warm. And what you see here on the shim stock is I am checking the patient's occlusion before we fit the morning reprogrammer. Now, why do that? Well, because the patient says, oh yeah, my back teeth hit, what do they know? And for years, I didn't check with shim stock, and I got faked out lots of times because the patient's like, oh yeah, my bite's normal. Yeah, no, it wasn't. So you want to figure out that the bite's off before you treat the patient, not after. So we check with shim stock the posterior occlusion. And guess what? If they don't have posterior occlusion on certain teeth, we document it. So now we know, well, hey, you didn't have good posterior contact to begin with. It wasn't the oral appliance therapy. It was just, that's the way it is. Okay, and we would talk to the patient about that too, help them understand that. So check with shim stock before you fit your morning reprogrammer. Make sure they can hold shim stock posteriorly. Then we make the thermocryl or thermoplastic, the Thermacryl Plus, into a Jolly Rancher looking kind of candy there. We put that on the lower front teeth, and then we have the patient bite down. I'm having the patient kind of push with his tongue forward a little bit, and I don't want the material to overlap the facials of the upper front teeth. So I want to be able to see where those incisal edges seat into the morning reprogrammer. Now, while this is in the mouth setting up, we have them open a little bit and check with the shim stock. Can he hold shim stock with the morning reprogrammer in place? If he can, then theoretically, this is an actual record of his posterior occlusions. That makes sense? Now, if we're then sliding out the shim stock, if he can't hold shim stock, then we got to start over. We got to do it again. So we need to make sure that our morning reprogrammer is an actual real record of where that occlusion was pre-treatment, or in this case is right here. Now, the cool thing with this morning reprogrammer is we have a couple other cool stuff here too. We also have a record of where his lower front teeth were. If he comes in later and says, hey, my lower front teeth are crooked now and they didn't used to be, and the morning reprogrammer still fits, well, probably unlikely that those teeth moved, right? We also have a record of where those upper front teeth were. If the incisal edges seat in here, like they do here, 3 years from now, it's most likely that those teeth didn't move. Or everything moved together, kind of en bloc, everything moved together, but everything is all coming together still, which most patients couldn't care less if everything's all still together. So this morning reprogrammer is pretty cool stuff, can help you avoid those bite changes. This is another way to do it. If you are using any MyTaps or other tap appliances, you get these AM aligners in your kits there, and we'll just cut those into 3 pieces so that we can still do this anterior only effect. And my team came up with this. They call this the cowboy hat. So you just warm that up. Same thing. You stick it on the lower front teeth, push it down. The patient kind of pushes up with their tongue, and then you curl up the corners. You curl up the corners, and that gives us this kind of cowboy hat look, and the same type of thing. This is going to be a record of where their upper front teeth are, their lower front teeth are, and it's going to bring them into this position. So one of the keys, again, with the reprogrammer is checking with shim stock before and checking with shim stock as it fits, or at the end. So if you have your team doing this, which I would recommend, they would be checking with the shim stock, before they're documenting any changes or any problems with the posterior occlusion. They're checking with shim stock with the morning reprogrammer setting up and once it is set. And your job would be to come in and check that you can put in the set reprogrammer and the patient still holds shim stock, then you can rest assured, like, okay, cool, we did a great job here. We got a record of really where those teeth are. Okay, so that is the real key. Now, how the patient uses this is how you are using now any type of AM aligner or other type of device that you want to use. But one of the keys here is remember, always, always remember, have that patient leave the appliance out for that 10 to 15 minutes before using their morning reprogrammer. Give them a little break. You don't want them to take the appliance out, set it on the nightstand, put this in, and just put it down as hard as they can. And that's the real key, right? They cannot clench into this. They cannot bite really hard onto the morning reprogrammer, or they're going to push that condyle up, squeeze that tissue, squeeze that fluid that's in there, hydraulic force, and we're probably going to cause a synovitis. And in my experience, that is the biggest reason people have TMJ problems with oral appliance therapy, is literally injuring themselves after taking the appliance out. And this can be confusing as heck, because when I am consulting these doctors or people in my study club, stuff like that, and like, yeah, the patient has jaw pain. I'm like, well, when? Does it hurt when they wake up in the morning? Like, well, actually, no. They say it only hurts after they take the appliance out. This is often the reason that is occurring. So I hope that helps you with your patients.